The following segment is sponsored by the Upstate Center for Addiction-Treatment.
Coming up on a new school year, uncertainty might be the best way to describe a lot of families and how they are approaching what's coming. Psychiatrist, author, TV host, and dating expert Dr. Ish Major is here from the Upstate Center for Addiction-Treatment. Hi, Dr. Ish. Good to see you.
Hey, Margaret. How you doing?
I'm doing well, but most of us do not like uncertainty. We want a schedule of what is happening, when and how, and these soft plans we've been talking about to open schools, they leave the door open for a lot of anxiety. So what's happening? What are people feeling?
Yeah, so listen, we don't want any softballs when it comes to the safety of our kids, right? We want a 90-mile-per-hour fastball right across the plate so we know exactly how to hit it back. So what's really happening is we don't know what's happening because there's so much bad information that's going around. So one of the main criteria for any successful community is to be able to keep its children safe. So this week I've been speaking to a lot of really brilliant and very caring administrators and teachers in the upstate, helping them get squared away to reopen, right? But some of them have some really excellent guidelines, and then the other hard truth is that some of them don't when it comes to what that school needs to look like when it reopens. But they all know that they're going to need to get access to good testing, and that's where we come in. But right now, moms are worried, dads are worried, grandparents are worried. Kids aren't because they're kids, right? They shouldn't be. So this is what we need now more than anything is a sense of unity and community coming together for this common cause. And we're going to have to lean on each other for support. We're going to have to lean on each other for that certainty, to let each other know that it's going to be okay if we each do our part.
Well, we certainly don't want the kids to have to worry. So the parents are worrying, and the fears range from how to stay safe from COVID to what is the reliable plan for my kid every day while I work. And we just cannot quite know all the answers right now, can we?
Right. Everybody, no one person has all the right answers. Teachers and principals are not doctors and scientists, and they shouldn't have to be. And again, no one person has all the answers, but if we work together, this is a problem we can get ahead of, right? So this is the time when we've got to take advantage of each other's strengths and help prop up where we might be weak. So the academic community is going to have to rely on the scientific community to get their testing done. Scientific community, in turn, is now going to rely on the academic community to get that information back to help us all be that much smarter when it comes to how to handle this, right? We're going to lean on each other for certainty. Families are going to lean on families, other families. Friends are going to lean on other friends, and we're going to use what we know to figure out what we don't. Schools have guidelines, but they don't have consistent access to tests. Guess what? We do. You let us come in and do what we do best, and that's going to let you get back to doing what you do best, which is educate our kids and keeping them safe and happy in the process.
Yeah, well, absolutely. We've talked about your COVID testing, and those programs are just developing all over the place. Because of your work at the Upstate Center for Addiction-Treatment, you do have the good information about COVID testing, and you're able to implement those and help some of the schools work through what their process is going to be. What should we understand about what's going on?
Yeah, so that's a big part of what we're doing now. We're partnering with a lot of schools, local churches, and local businesses to help them reopen and stay open, right? Getting the doors open on Monday isn't the question. Keeping them open every other Monday is the big problem. So that's what we've got to have in plan. So we come in and we take care of all of that testing for you so you can get back to doing the thing you do best. So here's what you got to know when it comes to COVID testing for everybody. There are two tests, the swab test. This is the test for you to take if you have active symptoms, cough, fever, aches, fatigue, nausea, shortness of breath. Swab test, those results give you active symptoms, but you don't get those results back for about a week, right? So you've got to be out of the mix for that week. Now, for everybody else, no symptoms or you haven't had any symptoms in 14 days, you should be getting the antibody test. This test measures your immunity, tells you your level of exposure, and now you can make a smarter decision on about whether you can or cannot go to school that day, whether you can or cannot go to work that day. So that's the thing that people need to be getting. And that's a very simple test. That's a drive-up test. We test everybody in your car before anybody gets out. You got your results in 10 minutes. Now we know, and you know how to go about your day. So it's possible, but you got to get to the right place and get the right test done. And it's actually a lot easier than you think once you got some good information.
And that information is so powerful as we try to learn what we're going to do with it and what the reactions are going to be and what plans are going to be in place. You provide all kinds of support. Talk to us about your main focus at the Upstate Center for Addiction-Treatment and what you're seeing these days.
Yeah, so Margaret, it's crisis on top of crisis, right? So to this week, we've got the school crisis and how do we get our kids back to school? But normally we've got the opiate crisis. And in the midst of all other things that are going on, the opiate crisis is really spiking as well. So what we do is medication-assisted treatment. We use Suboxone only to help you detox from your pain pills or heroin, whatever the case may be. You can get on and off in as little as 6 months, and you can get your life back. Margaret, one of the most rewarding things that happens to me and our folks in clinic is when somebody walks in after their first 2 months clean, and they sit down and that smile comes on their face and they're like, you know what, doc, I feel like I got my life back. And that's what it's really all about, right? That you're getting control of these circumstances that you think were just controlling you, right? Now you are no longer being wagged by the tail, right?
Yeah. And so there is a solution. People can get their lives back. It happens all the time at Upstate Center for Addiction Treatment. You've got locations on South Pine Street in Spartanburg and another in Anderson, and people can get an appointment by calling 651-8116. So what else is on your mind these days? Anything we should just keep in mind? I know you just kind of have to put one foot in front of the other these days.
Yeah, so we're fighting a battle, right? It's like we're in the middle of the thunderstorm and the lights are out. So what do you do when the lights are out in your house, right? You walk very, very slowly until you find your phone, your flashlight, or a candle to help you light the way. So as parents and grandparents and caregivers are trying to figure out what to do with their kids over these next couple of weeks, I think the thing that's going to give you some sense of peace, some sense of certainty is make the decision that you would be happy you made if you're looking back on this moment 10 years from now, right? Project yourself 10 years into the future, and whatever that person would look back and say, you know what, I'm proud of the decision I made then because it turned out well for my kids. That's the decision you need to make today. And so just get the 30,000-foot view, and that helps take some of the pressure and some of the uncertainty out of it, because the ultimate thing you're going to do is you're going to make the call that's going to keep your kids safe and healthy over the long arch of their life. And that's the thing that's going to bring you some peace over these next couple of weeks.
Absolutely. Well, we sure appreciate everything you're doing, and I can't wait to check in with you soon for another update. Dr. Ish Major from Upstate Center for Addiction Treatment, thank you.
Thank you so much, Margaret.